All right, guys, it's Ask Your Surgeon Facelift Edition.
What number of years of training and experience do you have in the field of facial surgeries?
What is it, 2022, so it's about 7 years.
What is the satisfaction rate of the patients who have received a facelift from you?
I would say 100%. So, I have had patients that, they were on like a little tweaking and stuff like that. That's maybe one or two cases overall, and I've done probably hundreds, and so it's pretty good. And even they were extremely happy with the results. So I would say 100% results are very, very happy. And honestly, I love doing facelifts, and the patients are so thankful and happy afterwards. It's amazing.
Am I a good candidate for a facelift surgery?
No, you're too young.
Thank you.
A good candidate, I'd have to see you face to face. Everybody's different. But a good candidate, I notice, will be somebody that has excess skin. So it's not just about, pulling your face back or anything like that. It's about if you have excess skin and you want to have a little bit, just enough so that you have good motion in your face. If you have drooping, the sagging right here, which are called the jowls, run over your jawline, those are all good facelift candidates. So I've had 3 to 4 really younger patients, like in their 20s, who, for whatever reason, they have excess skin on their face, and they were good candidates for a facelift. That's the main thing that I look for, is if you have that extra skin that we need to get rid of.
Can I review the testimonials of past patients who have undergone facelift surgery?
Yes, of course. You should review the testimonials, and I have a lot of them on there, all over Google and everywhere, so it's not hard to find.
Can I meet one of your staff members to familiarize myself with the practice?
Yeah, of course. You can meet all of my staff members. You can even meet me and familiarize with the clinic, with the procedures, how we do things. You can actually come in and see how everything is going. It's all to you. We're open, transparent.
Will the procedure be taken using general anesthesia or local anesthesia?
I use local anesthesia. It's safer, it's faster, it's cheaper for the patient. Your recovery is quicker. It's so much better. And I know it's a little bit daunting because you're going to be awake. We can even use a little bit of twilight, but the truth is that it's so much better. And it's a 2-hour procedure with a little bit of a half an hour given just so we can do different things, like when we're switching from one side to another and switching tools. But most of the time, it's unimaginable. You're sitting there and having a chat with the patient while working on their face. So it's an amazing thing, actually.
What will be the time taken to complete the procedure?
So I just answered that, but it takes about 2.5 hours. And that's, I'd like to take an hour on each side of the face, and then a half an hour, a little break time to switch over. Also, if the patient wants to get a drink or something like that, because it's 2 hours. So,
what are the possible risks?
Possible risks, you're going to have your swelling and bruising, which doesn't swell and bruise as much as even the eyes or the nose. You'll get a little bit down the jawline, maybe around the ears a little bit there. Scarring is always an issue, but we do different things to make sure our scars are minimal. And my patients usually you have a very thin line. Other risks, you might feel a knot under the skin because as we pull up the muscles and things like that, but those dissolve with time. Pixie ears are another risk that you have, but what I do is I'll bring the skin up and tighten it up right up here, so that way it doesn't be able to attach the edge of the lobe. Trying to think if there's anything else. Infection, you're going to be getting antibiotics prophylactically. We go through all of the risks and make sure that we mitigate them and minimize them as much as possible. So it's a very low risk procedure, honestly, even though the size of it, but we make sure that even those risks are minimal. All right, so that's it for facelifts, and I'll see you guys in the next video.